Obviously, you have to feel pulses, and a lot of times that's not done. And sometimes patients do have back pain and arterial pain from an iliac disease can be very, very similar. And this patient already he'd had a back operation, but when he saw the orthopedist, they were thinking they needed to revise an orthopedic procedure on his back. But they'd sent him to me for clearance. And so I was doing the routine physical exam and going through things. And he had physical findings of severe leg ischemia, and he had absent femoral pulses, totally absent. So we got a CT, and his aorta and both iliacs were totally occluded. Okay. And he actually, then when I looked at his feet, he had a small ulcer under his foot as well. So I called the orthopedist and I said, I think we've maybe found another cause for his leg pain right now. And I think certainly I'd be frightened to operate on his back right now with the aorta and both iliacs occluded. I think that could be problematic. And so he said, yes, why don't you fix that? We did. And his back pain, of course, went away. Now, I'm bringing that up, not even because I fault that doctor. He's not looking at the pulses, routinely. These diseases can be very, very similar. In fact, one of the differentiators that we use between it coming from your back or coming from vessels is walking. Okay, and what do I mean by that? Well, if it's coming from the back, often if someone walks, for instance, holding a grocery cart or walking with a walker, they don't have the pain because they're supporting the back. But if they walk, and anytime they walk, the legs hurt, it's usually vascular. Otherwise, it doesn't matter if they're leaning on something because the muscles aren't getting enough blood. That's one. But, in terms of speaking about patients where I learned a whole lot, I had one man that came to me and he had had 5 surgical procedures on one leg. He had horrible gangrenous changes. He had osteomyelitis of his great toe, which I could see by picking up a little flap of skin on his toe that was already there. He says, "Doc, do you think you can help me?" And I did Doppler on him, and I had no arterial or venous Dopplers. I looked at the CT and the MR studies that had been performed, and these were world-class hospitals where this man had been worked on. And there were twigs of vessels below the knee that they had seen. They had never, ever seen the perineal vessel, which usually, if it's there, you see, But in this man, it just didn't show, but it was there. And this man begged me to intervene on him. And I said, I just don't think I can help you. By all things that I see, your foot is unsalvageable. He says, "Doc, please try." And I said, "But I'm fearful I will hurt you." And he says, "Doc, not like I plan to hurt myself if you can't help." And very clearly, he told me he had bought a gun and he planned to blow his brains out if I told him I couldn't help him. He told me that. He was dead serious with me. He had already lost his other leg in an amputation. And he says, "Please try." So I got him to sign a very convoluted consent form. And I told him, I said, "Look, the insurers will not cover this. I'm quite certain of that." And that he was pushing for this. As it turns out, I did the procedure. I found that hibernating perineal artery. This man was we got blood to his foot. He had a transmetatarsal amputation and skin grafting. And 13 years later, he still had his leg. And that was one procedure. Well, it's more than one procedure if you take the skin grafting and the other things, but one procedure. And we found a vessel that showed up no other way. Now, what did I learn from that? I learned that our absolute knowledge is not absolute. That I should have seen those vessels by CT. I should have seen them by MR. And those weren't performed at my institution. Those were performed at some of the most well-known institutions in the world. They were performed by good people. And the Doppler study, they also had not seen any flow. How can I explain that? I can't. So it was perplexing. But it opened up my eyes. Sometimes there are things that go beyond our ability to understand. Since then, I've worked on many things to see if can we better delineate patients like that. And we're getting a clue here or there, some things that might change. But medicine is a journey. I've said that before. It's a journey. There are surprises along the way. There are heartaches. There are heartbreaks sometimes along the way. But the sum total should always be positive, especially if we do the right things. And one of the keys is not letting it get to that point. Again, we talk about all the great interventions that we have and stuff, but I wonder if we lived in the perfect world where we took these people with risk factors and we erased those risk factors early on. What could we do? And that's really what we have to strive to get to.